The next set of exercises are the wall slide progression. And these exercises are going to use a simple wall to allow you to exercise your shoulder and be able to raise your arm up above shoulder level. Jim's going to show, at first you're going to start off with your hand right in front of you. You don't want to reach up too far. You want to start there and allow the wall to help you raise your arm. He's going to use his other hand to help assist. And at first you may only be able to get about 3/4 of the way up, and then you'll come back down. But with each and every day that you do these exercises, you're going to get a little bit farther up the wall. Now, once you start getting a little bit farther up the wall, we want you to use your feet to walk into the wall and allow that hand to go all the way up. The second exercise in the wall slide progression is called wall slides with liftoff. And all we're doing, we're going to start off with the wall slides as you've already done before. And sometimes you'll do 5 or 6 of these as a warm-up first before doing your liftoff. But here we're going to go up the wall, and Jim's going to go all the way up to the top, and now he's going to lift his arm up off the wall and put it back on the wall and then come on back down. Sometimes when you do these, you're going to need to assist with your other arm to get it off at first. So Jim's going to slide all the way up the wall, he uses his other arm to help assist it off and put it back down. And that's okay. But as you get stronger and stronger each and every day, you'll be able to do it on your own. The final exercise in the wall slide progression program is called wall slides with eccentric lowering. And Jim's going to demonstrate it. So we start off with just sliding up the wall. He's using a water bottle, lift it off the wall, then you turn to the side and then lower it down at a 45-degree angle. By doing that, he's stressing the rotator cuff muscles that we repaired while they're being lengthened. And that has been shown to be the best way to strengthen these muscles. The next set of exercises involves using thera-Band, which is an exercise tubing that we can use for resistance exercises. The first most important one is similar to what you did with your scapular retractions, and that we're trying to build up stabilizing the shoulder blade. You can wrap these around a doorknob, but I'm going to hold it for demonstration purposes today. So the first one is a scapular row. So he's going to pull his shoulder blades together and pull his elbows back. And you can see his elbows are parallel to the floor as he pulls it back. And here we're going to show the back. You can see how he's squeezing back. We don't want you to shrug up. We want you to squeeze back to strengthen this. And you'll do sets of 10 to 15 of these exercises as you go through the progression. The next set of thera-Band exercises are to strengthen the deltoid muscle. And especially if you've had a reverse shoulder replacement, the deltoid is very important to be able to raise your arm following that surgery. So again, you're going to wrap the thera-Band around the door, and then your arms are going to come straight down. It's very important to stand up perfectly straight and not bend over. Keep the elbows straight, and now you're going to pull backwards. When you do this exercise, you should feel it in the back of the shoulder, and we're strengthening the posterior deltoid muscle. After you've completed that, you're going to pass the bands behind your back so that you're facing in the opposite direction. And again, you've got to stand up very straight, keep the elbows straight, and as Jim's doing, he's pulling forwards. Now we're strengthening the anterior deltoid muscle, which is really the most important muscle to raise your arm after a reverse shoulder replacement. It's still important for rotator cuff repairs and other instability surgeries that we do for the shoulder, but it's just most important for the reverse. The next set of thera-Band exercises involves rotation, and this is very important for the rotator cuff. These are the lower rotator cuff muscles that help stabilize the shoulder. Many times we're not repairing these muscles, but we're repairing the supraspinatus, which is the top rotator cuff muscle. These are even more important in the rehabilitation because we want them to be strong to allow the top muscle to heal. So the first one we're going to do in the left shoulder is the external rotation exercise, where Jim's going to keep his elbow in it tight at his side and then rotate out as far as he can go. One of the reasons we start off with a very light band is so that you can do this whole exercise without struggling. We don't want it struggling, especially in the early postoperative period. We want you to do these exercises on both shoulders, and there's a number of reasons. So now Jim is going to come and now go in the opposite direction with his right arm. The way our brains are formed, by strengthening the non-operative side, it actually helps the operative side get stronger. It also gives you a systematic break in resting that arm before you move on to the next exercise. So now you've changed positions, so we're going to work the left arm in the opposite direction. So now Jim's going to be pulling across his body, and this is strengthening the front rotator cuff muscle. And then after that set, he'll bring the right arm up, and he'll start to work it in external rotation as well. So you're doing both exercises for both shoulders, and you want to bring the exercise up to the waist level and rest the other arm while you're doing that.